retinopathies in Ayurveda and application of treatment protocol. Retinopathies are the vascular disorders of retina. We commonly come across retinopathies like diabetic retinopathy, hypertensive retinopathy. The treatment for retinopathies have been advanced with technologies in the modern therapeutics, but it has some limitations. Ayurveda shows broad spectrum of eye diseases and its management. So today we have eminent speaker Dr. Sri Kumar sir, Associate Professor, Government Ayurveda College, Thiruvananthapuram, Ernakulam with us to enlighten the knowledge regarding understanding of retinopathies in Ayurveda and application of treatment organized by Department of Shalakya Tantra, Sri Jagadguru Gavisidreshwara Ayurveda Medical College, Koppal, and the Association of Shalaki, Karnataka branch. Tena vina trinamapi na chalati. Without the supreme deity, a single grass can't move. So we take a few minutes by praying that supreme power. Om Namami Dhanvantarim Madidevam Surasurairvandita Padapatmam Loke Jararubhayam Mrityunasham Dhataramesham Vividhaushadhinam Dhanvantarim Ramanatham Sarvaroga Nivarakam Ayurveda Pravartaram Vande Pirushadayakam Sarve Jana Sukhino Bhavantu Sarve Santu Niramayaha Sarve Bhadrani Pashyantu Ma Kaschid Dukkha Bhag Bhavet Om Shanti Shanti Shanti. I would like to request Dr. Veeraya R. Hiremath, Dean R&D, Professor and HOD, Shalakya Tantra, Sri Jagadguru Gavisidreshwara Ayurveda Medical College, Koppal, for welcome the gathering. I would like to request Dr. Veeraya R. Hiremath, Dean R&D, Professor and HOD, Department of Shalakya Tantra, SJG Koppal, for welcome the gathering.
Thank you, Gagana. Om Shri Gurubhyo Namah. Welcome to all Shalakis, especially my teachers, my friends, and all Shalakis. Today's webinar is this international webinar. It's a very interesting topic, especially our chief guest today, our chief guest, Dr. Suvarna Gudacha Madam, is welcome to you, Madam. And today resource person, Sri Kumar Sir, welcome to you, Sir. Namaste, Madam. And all Shalakis, really, I am so much happy to because more than 350 registered this webinar. I am so much happy because Shalaki that much interest to learn and take the knowledge. They are so much happy in our college, especially Jagadguru Vishyadeshwara Ayurvedic Medical College, Koppal, Karnataka. Our principal, management, director, and all current task members and central members, and all welcome to you. Especially, our aim is to take the knowledge and apply that treatment protocol in a particular disease
Recording
condition.
in progress.
That is our aim. So that's why, once again, welcome to you all. Advanced, wish you happy Ayurveda Day, all of you. Once again, I don't take that much time. I hand over to Gagana.
You, sir. We also welcome you, sir. I request Dr. Suvarna Guleche ma'am, President, the Association of Shalaki India, to talk few words regarding this event.
Namaste. First of all, I congratulate to organizing committee or Department of Shalakya Tantra of Sri Jagadguru Govi Siddheshwara Ayurved Medical College, Koppal, and the Association of Shalaki, KSB, that's Karnataka State Branch, for organizing such a nice informative webinar on a burning issue of retinopathies in by Ayurvedic approach with a huge number of registration. The burning issue that is the subject of also is truly selected on retinopathies by Ayurvedic approach and treatment is very essential in this critical era because modern science have some limitations in the treatments and after surgical treatment also there are some issues remain on the retinopathies. I also eager to listen Dr. Sri Kumar Kesar on the retinopathy lecture. I especially thankful to Dr. Principal Sir of the Ayurved College because you are giving such a nice opportunity to the department of Shalakya Tantra Koppal. Because I remember last year also you have organized a very good seminar on the ENT subject for the college. For the students, you are doing such a nice activities. So from the desk of the Association of Shalaki, from the desk of President, TAS India, I congratulate you. I thankful you for those nice webinars. I think a webinar is organizing you first time, na, Dr. Viraya? So you organize the seminars. Webinar is the for first time, but your IT also very good IT arrangements also. And especially I am thankful to Dr. Venkatesh sir, President KSB, and dear Dr. Viraya. I can tell that Viraya sir is so enthusiastic and he is active for the department that students gain the benefits. So my best wishes from the desk of President. Wish you all the best.
Thank you,
And
madam.
also do some efforts for association and membership also. Okay?
Yes, madam.
Yeah. Okay. Best wishes.
Thank you, ma'am. Thank you so much. It is high time to know about our eminent speaker, Dr. Sri Kumar sir, working as Associate Professor, Government Ayurveda College, Thiruvananthapuram, Ernakulam. He completed his UG from Government Ayurveda College, Thiruvananthapuram, and PG from ITRA Jamnagar, and pursued PhD degree from Gujarat Ayurveda University, Jamnagar, and has teaching experience of 14 years, awarded many awards. First rank and gold medal winner in MS Shalakya Tantra 2005 from Gujarat Ayurveda University, Jamnagar, and National Ayurveda Scholar Award for Best PhD thesis on 2011, and Dabur Medha Award in 1998 to 1999, and Nagarjuna Research Foundation Award in 2000, and recognized as PhD guide under Kerala University of Health Sciences, given many live demonstrations of surgical procedures Arma Chedana Bhedana Lekana done at Kushila Sharma Ayurveda College, Hubballi, Karnataka, given live demonstration of Netra Kriya Kramas at national seminar at Government Ayurveda College, Thiruvananthapuram on December 2022. And he has been a resource person for various CME for Shalakya conducted all over India, given more than 30 presentations in various national and international seminars, and given more than 20 publications in offline and online journals. So it is our pleasure to have you, sir, with us. Without taking much time, I would like to hand over the session to you, sir. Session is over to you.
Okay, thank you. Thank you for the nice introduction. Respected Dr. Suvarna ma'am, my friend Dr. Viraya sir, Dr. Gururaj sir, thank you for giving me a chance to discuss concept in Ayurveda. So first of all, I wish to happy Ayurveda day to all. So just I try to share my screen. So I think the screen is visible.
Yes, sir.
Yes, sir.
Okay, so I'm starting the presentation. So I think as the introductors said that the topic is a very vast one. So I will try to give an idea about the understanding of retinopathy and some my clinical experience with treating such cases. Okay, so these are the contents of my presentations. I will try to wind up the session within 1 hour. So actually, we are going to discuss the retinal anatomy and physiology in Ayurvedic perspective and the pathological aspect. So it is essential to know the anatomy, physiology, and the pathology in Ayurvedic perspective so that we can treat such cases. And the main common retinal pathologies that we are encountering in current OPD and how we can approach those conditions, and if 1 or 2 case discussion, if time permit, and the discussion and conclusion. So as we all know that Acharya clearly mentioned that Sarvendriyanam Nayana Pradhanam. So what may be the specific peculiarity of eye when compared to other organs? So we can say that eye is the one and only structure where we can observe few specific features. So that is especially in the retina. So this is the site where we can direct visualize the arteries and veins. So we can easily identify the systemic diseases and the condition of the body by assessing the eye. And the arteries are superficial than veins. This is the one of the main peculiarity found in retina, and it is the dichotomous branching of vessels, transparent vessel wall, no fenestrations in the capillaries, no blood supply in the macula, and the optic nerve is covered with the CSF and direct communication to the brain. So by assessing all these factors, we can see that the retina is a unique structure when compared to other structures of the body, and by assessing the eye only, that means the Ashtasthana Parisha, eye is one of the main factor, and by assessing the eye only, and especially the drishti, especially the retina, we can assess a lot of conditions of the body and what is the health status of the body. So when we are moving to the Ayurvedic view, can it be considered as a padala? Yes, it is a Asthyastrita. Acharya mentioned as it is an Asthyastrita padala. So it is, we can understand that Acharya mentioned if the retina is involved, then we should consider the deeper dhatu involvement and within asraya asrayi bandha with vata. So in the functional aspect, we have to consider the vata dosha for the management, because vada is the factor which is indriya pravartakam. And while during the treatment of retinal degenerative conditions or neuro-ophthalmologic conditions, we have to give more emphasis to the Asti Majjagata Dhatu concept, and then comes the Panchakarma as a mainstay of the treatment of the neurological diseases of retina. So it can be incorporated to the fourth padala of the eye. So it is the Asthyastrita padala. So the layer which is more close, that is the retina, is dependent on the orbital cavity, and most of the retinal pathologies, Vasti is an important treatment. So Ajay in maintaining the normal functioning of
The speaker will join back. He just cut off with net. He'll join back. Wait a minute. You're audible.
I think now it's okay.
Yes, sir. Yes, sir. Please.
Okay, okay. So sorry for everyone. I think due to some connection issue, it was okay. So we will continue with the presentation. So just we are discussing about the importance of tridosha in the maintenance of normal retinal health. So we have discussed the role of Vata is the Indriya Pravartaka, that is the stimulating factor. So in dealing with the neuro-ophthalmology cases, we have to give more emphasis to the Vata dosha, and the most important dosha to be managed. That means Vata is the dosha which will particularly function the process of vision. And many of the degenerative conditions are common. And in that of degenerative conditions, we have to give more emphasis to the Vata. Here comes the importance of Vati. And the role of Pitta means the Jivana function. The Jivana function by the Pitta and the Rekta, that means it's mainly the macular functions, and the Pitta Rekta, it will important for the color perception and mainly the vascular functions. And Hajari Delhana narrate Teja as the Agni, which implies the Rekta, which correspond to the all of the Pitta in the eye. So, by considering both these, the Vata and Pitta are equally important. And what is the role of Kapha? Role of Kapha is to maintain the integrity. So, while in the diabetic retinopathy cases, the integrity of the blood vessels will be lost, and it will start the leaking, and exudation will start. And it will maintain the stairyatva of the retina, and the loss of vascular integrity mainly occurs in the chronic disease. So, each and every dosha have equal importance in the maintenance of retinal health. So we have to assess which dosha should be addressed in the management. So while we are considering, so retina is fully supplied with the nervous tissue by the 10 layers of the retina, and it is supplied by the vascular tissue. So retina is mainly having the nervous and the vascular tissue. So the Vata and the Pitta are the main factors which will function the normal functioning of the retina. So the full blood supply, dichotomous branching, and the retinal capillaries will always nourish the retina, and these 10 layers of this retina is highly specified for the perception of the vision, and mainly the specific functions like color vision, field of vision, everything is maintained by the nervous as well as it is supported by the vascular tissue. So the retina is mainly supported with the Vata dosha, and the Kapha dosha is also plays a role. So we will discuss what may be the role of Kapha. So the Vata, when it increases is Rukshada, and the Pitta which will vitiated by it will causes the more Tikshnada. So the Kapha dosha will balance this Rukshada and Tikshnada. So the balancing factor is the Kapha dosha. So the Vata and Pitta are the functioning dosha, and we can consider the Kapha dosha as a balanced. So if the balancing system is lost, then there may be the Vata Pitta Kapha will be there. So we have to if the Kapha dosha is in a stabilized form, or in the Kapha is in a healthy I think now I am audible, so we can proceed, isn't it?
Yes, sir, please.
Okay. So sorry for the disturbance. So we are moving of the retina physiology that we have already mentioned, that Vata Pitta dosha, and it is the functional doshas, and Kapha dosha is acting as a supportive dosha. So when we are understanding this fact in the terms of dhatu, then we have to consider the asti dosh, asti dhatu and rasa rekta dhatu, and again the rasa. So here rasa rekta dhatu is the key factor, and the supporting dosha is the kapha dosha. So there comes a question.
Sir, please
That
make
means
the slide
is
full
tarpana is indicated in
screen.
Okay, isn't okay?
Yes, sir, please.
Okay, so here comes an important question, where is tarpana is indicated in every ophthalmic conditions. So actually, when we answer this question, we have to say that the tarpana is not at all indicated in every of ophthalmic conditions. Okay, so the conditions where the tarpana is indicated is equally important, that where what are the conditions in which tarpana is contraindicated also. So we can say that tarpana is a brahmana and snehana procedure, and the snehana is very important in the maintenance of vata dosha. So it will reduce the rukshata of vata. So tarpana is a classical indication where vata visheshan occurs, and we can easily administer in a condition of vata vitiated disease. We can administer the tarpana, and when the visheshed dosha is pitta or the associated rekta dhatu, then it will increase the dravatvam. So if there is a pitta rekta predominant condition, it will increases the dravatva, and it is contraindicated. So in that condition, for example, the exudative phase of the diabetic retinopathy, in those conditions, it will promote the leakage and it will increase the aggravation of the edema. So in the retinal edematous conditions or the retinal leaking conditions, it should be done with utmost care. So the universal contraindication if there is a kaphanubandhatva is there. So we can assess the indication of tarpana by the associated dosha. If the vata is there, then is universal indication. Pitta with care and the kapha not at all indicated. So ruksha pudapaga, it is acharya in while in the management of the kavacha abhishanta chikitsa, acharya Susruta clearly mentioned that Rukshaistataschodana Samvidhane Tadeva Rukshaihi Putapaka Yogai. That means the Ruksha Putapaka is the only treatment advised in the management of the Kapha Abhishanda by the Acharya Susruta. Here there is no mentioning of doing the Tarpana. So this is the condition where the Putapaka is only indicated as a therapeutic procedure. So while we are considering this concept in basis of the blood retinal barrier, the blood retinal barrier is particularly the restrictive physiological barrier that regulates the flow of nutrients, that is metabolic waste products, ions, proteins, and water flux into and out of the retina. So the total retinal metabolism is controlled by the blood retinal barrier. So while we are analyzing this blood retinal barrier, is inner and outer blood retinal barrier function to maintain the retinal homeostasis, outer blood retinal barrier at retinal pigment epithelium from choroid to the subretinal space and inner to the inner retinal microvasculature. So the free flow of fluid and solutes are prohibited from the vascular lumen to the retinal interstitium. So the endothelial cells are closely bound together. So it means it is closely bound together. That means the steirya bhavam about the lumen by the intercellular junctions of zona occludens. So the blood retinal barrier that we can understand with reference to the kapha dosha or rasa dhatu. So if we are considering this blood retinal barrier, we should consider the integrity of this retinal vasculature and the blood retinal barrier. It is close relation with the kapha dosha and rasadhatu. So how it maintains the blood retinal barrier, that means the sthirya guna, that means the tight junctions, the regulation of the metabolites, that is the agni. So the role of the rasadhatu and the purity of rasadhatu, and is strongly related to the diet and the physiological status. So in rasadhatu visheshan, Acharya mentioned that guru shita madi snigdha madi matra vahani dushyanti bhajat chintyanam chadi chintana. So psychological factors are important for controlling the blood retinal barrier. So we can say that if the rasa in a pure form and the kapha dosha in a stable form, then the blood retinal barrier will be maintained. So if any disruption of this blood retinal barrier occurs, there comes the disease pathology. For example, the tension or the sleep alterations or the dietary variations immediately precipitate the CSR. So in those conditions, we have to emphasize on this kapha dosha and rasadhatu. So while we are moving to the pathological aspects of the retina, we can conclude that the retina is a factor where there is neurotransmission and circulation, and it is controlled by the proper maintenance and the nutrition, and the health of the retina is controlled by the blood retinal barrier. So when we are moving it into Ayurvedic terminology, this blood retinal barrier can be compared with the kapha dosha or rasadhatu. So the for the proper health of the retina, the rasadhatu should be in a pure form, and all the factors which will cause the kapha vitiation or rasa dushti should be avoided. And the neurotransmission, that is the purity, the function of the vata, and the circulation is the function of the pitta. So when we are comparing this concept in the way of diabetic retinopathy, we can say that in diabetic retinopathy, what it happens. So the diabetic retinopathy is a kapha vitiated condition. The prameha is a kapha pradhana dosha, and in chronic stage, it will destroy the stability of the kapha dosha, and it will interfere the other dosha. So it will causes the neurodegeneration and the microvascular occlusion. These are the two key factors which will causes the diabetic retinopathy. So while it will occurs, it will block. That means it will causes the vitiation of the kapha dosha and the vitiation of the rasadhatu. So it will block or it will causes the alteration of the blood retinal barrier. So in all the diabetic retinopathy, there will be some part of the retinal edema will be there. High risk of CSR, high risk of CME. So all type of the edema will be there due to the alteration of the blood retinal barrier. So when we are assessing this, so by analyzing this pathophysiology, we can say that the diabetic retinopathy, the first and the two factors should be manifesting in the retina as a part of diabetic retinopathy, that is neurodegeneration and microvascular occlusion. So it says that the retinal neurodegeneration is an early manifestation of diabetic eye disease and potential neuroprotective therapy. So we can say that the first and foremost things happens in the retina as a result of diabetic retinopathy is that retinal neurodegeneration. That means the nervous stimulation from the retina. That means the variations in the ERG and EOG will be there in the initial manifestation of the diabetic retinopathy. And secondary is the vascular changes in diabetic retinopathy. So by this, we can see that when it is easy to analyze whether the eye is in a risk of diabetic retinopathy, we can go for a neurological study of the retina as well as a vascular study of the retina. So these are the two factors we can easily correlate in Ayurvedic terminology by the functions of Vata and Pitta. So Vata and Pitta are normally functioning and Kapha is a supportive. So if the support is lost, then the natural healthy factor which plays in the neural function and the vascular function will be altered. Okay, so we can say that the kapha dosha is a srodha-rodhaka dosha, and it will disturb the balance of vata pitta, and it will causes the neural, vascular, and degenerative changes. So while understanding the retinal pathology, we have to give this concept in our mind. So the rasadhatu, raktadhatu, and asthidhatu plays a key role. That means the treatment should be started with consideration of rasadhatu and raktadhatu, and we have to give full support to the functioning of the Vata dosha by adopting the various types of vasti. So Acharya clearly mentioned that Chakshu Stejo Mayam Tasya Vishesha Sleshmado Bhayam. That means even though the Vata and the Pitta are the factors which is responsible for the normal functioning of the retina, this normal functioning will be interrupted only when there is a vitiation of the kapha is there. So in a patient, if the kapha and rasa are in a proper way, that eye is in a healthy manner. So that only we have mentioned that if you are doing the tarpana in an unnecessary or not indicated conditions, it will cause us the vitiation of the kapha dosha. So time. So we have to give more emphasis if we should not allow the kapha to be vitiated. So we have to adopt the proper anjana karma in the dinacharya, and we have to take the trifala as a daily practice for maintaining the kapha dosha in a normal stage, so that we are protecting the vata and the pitta. So in management, we have to consider the anubandha dosha also. That means if the edema is there, then we have to consider the kapha dosha, and the dot and bloat hemorrhages we have to consider treatments which is mentioned in the Timida Pradesh our classics, so that in Timida Pradeshada, in which it is depending upon the kapha, this vitiated dosha, that means kapha timira chikitsa or pitta timira chikitsa, rakta timira chikitsa or sandhimata timira chikitsa, anything that we can adopt. So these are the challenges that we are facing in retinal disease. That means the retinal degenerations. Actually, retinal degenerations usually occurs in the old age. As we have discussed, it is a vata predominant condition. So that becomes a badly prognostic disease. And recurrence is high chance of recurrence if the patient is not following the proper pathyavatya. That means if the patient is not following the pathyavatya, means it will cause us the vitiation of the kapha dosha, and that kapha dosha will again go to interrupt the vata and the pitta. And the irreversible changes, that means changes which are happening in the retina, most of that conditions are irreversible, and it need a continuous and costly medications, and many are non-responding cases. In either also, in some cases, in the tridosha and in long-standing cases, it is some conditions it is non-responding also. So the treatment part and the post treatment, that means the pathyavatya, both are equally important in the management of retinal diseases. So these are the main clinical presentations that we are facing in our day-to-day OP life. That is the CSR, diabetic retinopathy, macular or retinal degenerations, mainly the RP and RMD, vascular diseases, and retinal inflammations, and the optic atrophy. So I think I'm not able to cover all these conditions, but we will discuss a few of them. That means how we have to approach this condition. There is no doubt that we have to give considerations to tridosha. That means the conditions accordingly that we have already discussed. We have to give the emphasis to the tridosha according to the predominant dosha, and the anubandha dosha, we have to select the treatment, and more considerations to the vata pitta in the pathological aspect, whereas kapha dosha in the preventive aspect. So this is the combine of approach that we are following in our OP and IP, that is Havan, Virejanam, Nasyam, Mukhalebam, Shirolebam, Takradhara, Talam, Murtha Tailam, Vasti, and Rasayana treatment. That means it will be almost, we can adopt the treatment from this box. According to the dosha vitiation, we have to change the medicines and change the order of the application. So the retinal disease that we can broadly divide into three, that is vascular, inflammatory, and neurological. That means either it will be the pitta pradhana or it will be the vata pradhana, and we have to consider the kapha dosha, why it occurs due to the imbalance. And that in the neurological and degenerative, we have to give more emphasis to the Vata dosha so that the treatment should be ended with the various types of Vasti. So while we are understanding the retinal diseases in Ayurveda, it is completely mentioned in the Drishtigata Roga, and some are available in the Sarvakshi Roga Kilsa. And as per our area, most of the conditions are asadhya or yapya. That means even though in Ayurveda also it's mentioned that most of the retinal diseases, if it is manifested in a full-fledged way, it is an asadhya or yapya. Simply medically cured disease is very negligible. So if we can adopt the treatment which is mentioned in the classics, that means Timira Kaja Linganasha Chikilsa, Pitta Vidakta Chikilsa, Kapha Vidakta Chikilsa, Dhumara Chikilsa, Hriswa, Nakulanthya, Gambira, Hadatimanda, Akshipakati, and Sashofa, all these having some similarity with the retinal inflammations and retinal involvement. That means the treatments which is adopted as a specific line of approach that we can take in the practical aspect. So these are the diagnostic techniques. That means the diagnostic and a clear monitoring of the condition is very important for understanding the improvement or response of the cases to the Ayurvedic management. So vision test, regular interventional vision test. That means we have to take the vision after each and every major procedures, how it is going to be influenced. That means if you are doing the Snigdha Seka, that means if it is patient is having some blurring of the vision, then we have to keep in mind that eye is not able to accommodate the sneha. Then we have to change that medicine to the ruksha by adding the kashaya or adding some part of the dhanyamala. So we can change the treatment according to the variations in the vision. As if our treatment protocol is correct, then patient definitely going to improve. And the slit lamp examination, that is slit lamp biomicroscopic examination for the fundus. We have to see the full fundus very clearly, especially in the diseases pertaining to the pathological myopia for ruling out the lattice and the RD risk. So the fundus examination is very important, and the FFA, assessment of the bleeding. So by taking the FFA test, we can assess whether the dosha, that is pitta rakta predominant condition or the kapha predominant condition. So if that is edematous condition, we have to give more emphasis to the kapha dosha. So rukshana and Langhana treatment is always recommended. No Tarpana is indicated. And the Pitta Rekta is there, then the Shamana Pitta Rekta Prasadana drugs should be given. So like that, we have to take the lead of the treatment from the assessment by FFA. And the OCT, also very important, that is RNF thickness in Vata predominant conditions, edema in the kapha and the bleed in the Pitta Rekta. So by analyzing these tests by an interval in the IPD patient, it will give an idea about what is the condition and how it is improving with our treatment, and ERG and EOG for assessment of the Vata. For example, if a patient is going to be if a diabetic patient, whether he is having some risk of diabetic retinopathy, as our discussion, it is revealed that the neurodegeneration is the first and the foremost thing which is happening in the retina. So we can send the patient for a neurological study. So if it is disrupted, then we can understand that Vata is going to be deranged by the influence of the Kapha dosha. So we have to give the proper elimination of the Kapha dosha by adopting the Nasya as a Dinacharya. Okay, so in retinal vascular disease, so we are just most of the condition, that means most of the diseases which is coming in the retina is related to bleeding, because as we have discussed, retina is a playground of the Vata and Pitta. So the pathological factors, so we have to assess why the retinal bleeding disorders are occurring. So we have some idea in mind that Pitta is vitiated due to the influence of the Kapha. So we have to find out from which cause it is going to be interrupted. So we have to give emphasis to the Rekta Dushti Nidana and the Nevaga Nidana. So the Charaka in Vidishonidiyam chapter, Ajay mentioned a lot of Rekta Dushti Nidana. If the patient is having that Rekta Dushti Nidana along with the Netraroga Nidana, and the most of the Nidana which is mentioned in the Netraroga Nidana is overlapping with the Rakta Dushti Nidana. That means the Rakta Dushti Nidana and Netra Roga Nidana simultaneously it will causes the manifestation of retinal vascular disease. So by identifying these factors, we can easily advise the patient to prevent the recurrence, because the retinal bleeding conditions are high chance of the recurrence. So Nidana Parivarjanam Chikilsa. So we have to advise the patient for the further, means get rid of the further initiation of the dosha. So while we are assessing the Nidana Panchaka of retinal bleeding disorders, so Nidana, which should be either from the Vidishonitiyam or Rektapitta Nidanam or Vadashonita Nidanam or Netraroga Nidanam. In all these type of Nidana should be analyzed to find out the cause. And in the Samprapti, we have to adopt the Samprapti of Vadashonita Nidanam, Urdhaka Rektapitta Nidanam, Abhishinta Nidanam, and Ushna Vidakta Nidanam. That means in Ushna Vidakta, Acharya clearly mentioned that Ushna Tapta Sahasa Shidava Nimanjana Tridosha Rekta Samprupto Yati Ushmortham Tadokshi. That is a Samprapti Acharya mentioned what it will happen in retina when there is a Pitta vitiation occurs. And the clinical picture, we should consider the Urdhaka Rektapitta Chikilsa, and the diagnosis we can adopt the Parimulai. Parimulai, Acharya Susruta mentioned that Pittam Kuryat Parimulai Murchidam Rekta Tejas. So we have to consider the diagnosis in the way of Parimulai Thimira and management. Management we should give systemic and local. Systemic, we can adapt to the Vadashonata Chikilsa. In Vadashonata Chikilsa, Acharya clearly mentioned the Kshiravasti Prayoga and the Urdhaka Rektapitta Chikilsa. Urdhaka Rektapitta Chikilsa, Acharya clearly mentioned about the Stambananasya. So both we can adopt in the systemic management, and the locally we have to adopt the Rekta Pitta Vishanta Chikilsa, Pitta Chatimira Chikilsa like a Mukhalebam, and the treatment adopted in the Parimulai can also be incorporated in the management of the vascular disease. So we can conclude that in the bleeding disorders of the retina can occur by the three ways. Either it will be coming from the Netraroga Nidana or from the Vadashonita. So the Rekta Vriddhi is there. It is easy to eliminate by the Rekta Moksha procedure, and the Dushti should be corrected with the Rekta Prasadaka Karma. So the Vishesha Chikilsa. So what may be the specific treatment should be adopted. So that we have discussed now the common line of approach and what should be the specific treatment. That is Urdhaka Rektapitta Chikilsa is the specific line of management, and the Pittaja Timira Chikilsa is also should be adopted, and the Pittaja Abhishanta Chikilsa. So these are the specific treatment which is mentioned or pertaining to the Shalakya Tantra that we can adopt, and the Vadashonata Chikilsa which is mentioned in the Kaya Chikilsa also that we can adopt in the management of the retinal bleeding disorders. So the Pitta Timira Chikilsa, Acharya clearly mentioned that Shidaha, Shiro, Mukha, Leva, Sega, Shodhana Vastaya. That means Mukhalebam, Shiro Lebam, and Netra level, that is Vidalaga, are the three main factors which is useful in the management of the Pittaja Timira and the Pittaja Abhishanta Chikilsa that also we can take. So in the means treatment and Ushna treatment both should be adopted alternatively. So that is very important in the neovascularization and perfused and non-perfused areas. That means if there is a retinal ischemia is there due to the ischemic vivo, so some area is not getting the blood. That is not getting the blood. So if we are doing the Stambananasya for a longer period, then that will again cause that the ischemia. That condition we have to give some break to the Stambanasya, and then we have to go for the Tikshnasya. So the Shidam Ushnam Kriya both in an alternative manner is also important in the management of the retinal bleeding disorders. The Kshiravasti, that means Panchamula, Kshiravasti, and Bela is also important, and Eshtimadu, Bela, and Panchamula as a Kshiraseva is also very important in the management. So, how we can manage these two conditions having, in my clinical experience, these two conditions is having the similar treatment, that is the diabetic retinopathy, that is exudative stage, and the CSR, that means the Sopahara Chikitsa and Srodha Shodhaka treatment. Then Srodha Shodhaka Nasya, that means the Tikshna Nasya, that means the Swarasa Nasya, Kashaya Nasya, Asava Nasya, or Madhu plus Thaila Nasya is also very important. The Kamala and Gadusha having a major role. Then Shitolebha, Takradhara, and Shodha Anjana are also very important in the diabetic retinopathy early stages and the CSR. And how we can manage the proliferative stage. And this proliferative stage is by the Sthavananasya, Shirolepana, Kshiradhara, and Ropananjana. And this venous occlusion also, we have to give more emphasis to the Artho, Shodhana, and Kabala. The local approach we have to give emphasis to the Netra Kriya Kalpa, Jaluga Vajarana, and Siravetha. So these are the medicines which is mentioned in the classics that we can use in the management of the retinal bleeding disorders. That means Netra Segam with Utpaladidhara, Manjishtadidhara, Shtikashaya, and Shidaloka Kashaya. And Shirasegam with Aragudadi Kashaya, Manjishtadi Kashaya, and Utpaladi Shirasegam. And in Aschodana, that is Chandanadi, Samudrafena with Stanya, Yeshti, Lothra with Krida, and in Anjana, Jadi Mugaladi, Chandanadi, or Elamir Korbu, and in Vida Lagunda Mukadi. So all these medicines are found to be highly effective in the management of bleeding disorders of the retina. And in Nasya, it is having a wide application in the management. So in the Stambhana Nasya is indicated in the bleeding, whereas the Shodhana Nasya is indicated in the occlusions. So in a ischemic type of bleeding, then we have to consider both these treatments. That means the Stambhana Nasya is we can do with Durva Swarasa, Dadima Swarasa, or with Kshira, everything is advocated with the Stambhana Nasya. And the Shodhana Nasya we can take with Varasa or Kashaya or Madhu or Thailam, both that we can take as a Shodhana. The Mukhaleba is also having a very good role in the management of this exudative stage of this retinal bleeding disorders. The Shirolebam is also having a very good treatment, and the Thalam is also having a very powerful treatment. That means mild form of it can be considered as a mild form of Murtadaila, and the medicines like Janamaya, the Rasna, the Churnam, along with the Durva Swarasam or Kshirabela, all these can be adopted in the management of bleeding disorders. And the Shirasega, it is also important. That means in Vada Kafacha conditions, we have to adopt the Takradhara, Kashayadhara, or Dhanyamladhara, especially the occlusion stage. And Vada Pitta conditions, we have to adopt the Kshirasega or the Sega, which means the milk processed Sega is highly found to be in the bleeding conditions. The Kshira Tarpana is the condition which is mentioned in some specific occasions by Acharya, that is means Samvrana Shukla, and as well as in the management of the Rektaja Abhishanta Chikilsa, Acharya mentioned the Kshira Tarpana. So the Tarpana with the medicated Kshira, it is that usually we are adopting the Lodra Kshiram or ST Kshiram, where the Tarpana should not be indicated, means Tarpana with the Hello, am I audible? Hello?
Yes, sir, it's audible.
Okay. So the Kshira Tarpana with the Lodra Kshiram and ST Kshiram are found to be in the management of the bleeding conditions. If that condition is not at all contraindicated, strictly not at all contraindicated for the Tarpana, then can adopt these two. And Murtha Chikilsa, as a general outline of management, we can move with the Shirolebam in Pitta Kapha Dhanyamla Dhara with Vata Kaphaja conditions, and Taila Dhara or Kshiya Dhara or Kashaya with Tridoshaja Visheshan, and Shiro Piju with Vata Pittaja Visheshan, and Shirovasti also in Vata Pittaja conditions. So while moving to the mainstay of the addressing the Vata dosha, we have to give more emphasis to the Vasti. That means indication in Vadika Drishtiroga, and in Drishtiroga Samanya Chikitsa.
Recording in progress. Recording stopped. Recording in progress.
Hello, am I audible?
Yes, sir, please. Yes, sir. Slides are not.
Okay. I think now it's visible.
Yes, sir. Yes.
Okay. So sorry for the interference. Okay, so now we are discussing about the importance of Vasti. So the indication is especially mentioned by the Acharya in the management of the Drishti Roga, and it is the best treatment in the management of Vata Vyadhi and also better treatment for the disorders of Marma. So the that is mentioned as the Chakshushivasti, then Erandamooladivasti, then Vipanjamooladivasti, Tiradvanavasti, Kshiravasti, Balaguluchadivasti, Panchachitakavasti, and Legnavasti, and last is the Yogavasti. So all these vastis having various applications. For example, the Kshiravasti is found to be the retinal bleeding disorders, and I'm not going to the details. So the mainly I would like to emphasize that the Rukshavasti with the Vaishondra Churna and Dhanyamla and Amurdotara Kashayam is found to be very effective in the management of CSR. So here I am just explaining one case, that is the ER-Vivo, a 30-year-old male patient presented in the OPD with blurred of vision for the left eye since 1.5 months. 2 months back, he met with an eye injury. So he also had a bleeding per rectum with hemorrhoids. So when we analyze the or take the case in detail, we can see that there may be one reason for the Apanavayu. So we have to correct that by mainly the pathology of the eye occurs due to predominantly of the Apanavayu. So the patients having any type of hemorrhoids or in any type of the treatment that we are adopting, we have to give Anulomana medicines as a general line of management. So this was the clinical conditions. See the vision in the left is 6 by 12. So the dilated fundus exam can see this is a clear-cut Vivo, and these are the internal medicines that we have prescribed. That is the Kolge, Kaisharagogulu, Garverandam with night and another tab, and these are the medicines that we have. Means treatment we have adopted the Sega with ST and Kshirabala Thailam, Vidalak with Mukadi Janamayadi, then Mukhaleva with Varai ST Janamayadi with Trifala Kashayam, then Talapodi Shiro Leva with Guluchadi, Kashaya Jurna, Manchistadi, and the Janamayadi in Laksha Kashayam, and the Kashaya Dhara in the head was given with the Guluchadi and Manchistadi Kashayam. So we have adopted the Adhomarga Shodhanam and Srodho Shodhaka treatment in the Rekta Pitta Stambhana treatment should be adopted in those type of conditions. And the next main treatment means disease that we are facing is the CSR. So just we have discussed in the management of the CSR, the Rukshavasti is very important, and all the treatment in the beginning should be addressing the Kapha dosha. So in some conditions of specific conditions, we have seen that Vamana is also having a good result in the initial phase of this CSR. Actually, the Vamana is contraindicated in the Timira, but when we are considering this Kapha dosha, which is manifest or Sthana Samsraya occurs in the Urdhva Chaturagata part, then Acharya mentioned that the Urdhva Chaturagata accumulated dosha should be removed from the Urdhva Chaturagata by Vamana. So we can think about the Vamana in the management of this early manifesting, that is immediately presenting the CSR. So this is a case that means we have just the before and after the Vamana. So it responded very well, but we cannot adopt it in a general management. Otherwise, if that is associated with the Pitta Rekta, then that Vamana itself will going to adverse, or it will increase the complications and it will lead to the bleeding. So only the simple means edematous condition, no other dosha is involved, then we can consider the Vamana. So this is the Ayurvedic management of current means recurrent CSR. So in this treatment protocol, we have admitted the patient and we have done the first, the Segam with the Trifala Kashayam, then Takradhara given, Shiro Lebam, Talam, Vicharanas. After that, we have given the Vicharanas Nehavana with the Guguru Tiktakam Kritam, then Virejanam also we have given with the Vibhati and the Drakshahima Kashayam, then Nasyam with the Swarsanasya with the honey and Saidhav. So it will comes in the category of Tikshanasyam, then Avagundhanam that we are given, and the Rukshavasti with Vaishondra that we have given. So by this treatment, you can see the vision became the 6/18 vision to the 6/6 full. So this is the before and after OCT result. This within 1 month, I think it is 17 November and this 24 November. So immediately that edema is observed, and the till date the patient is not at all having a recurrence. So this was a, as we have discussed, this is a recurrent CS. That means the patient was a recurrence of third time, and till now, so the treatment completed in 1 year back, November 22. So till date there is no recurrence in this condition. So this is the line of management for handling the retinal edematous conditions and retinal bleeding conditions. So I am just giving how to approach the retinal degenerative conditions. So retinal degenerative conditions means mainly there will be the dry type of ARMD, RP, and optic atrophy. So we can see in the ARMD cases, if it is a dry type, then we can easily manage with retinal degenerative medicines and Brahmana therapy. But it is the wet type, we have to give emphasis to the underlying, that is Anubandha dosha, that is Pitta Rakta dosha. So in RP case, there is no for doing the Brahmana. So Brahmyastu Murdul, that concept, we have to open up the vessels. So we have to start the treatment with the Rukshana, and then we should end up with the Brahmana and Rasayana. So the Brahmana, Chakshushi Rasayana, and Chakshushi Vasti is also very important, this type of retinal degenerative conditions. So considering the Asti Majja Dhatu in the chronic degenerative conditions, that is Vata Kapha or Vata Pitta, there's Kevala Vadaja Chikilsa can be adopted. So the Brahmana Nasya is the mainstay of the Nasya treatment. That is the Krida Nasya is only indicated in these conditions. That means we can do the Nasya with the Mahatraifala Kridam or Jivantyadi Kridam or Jivanya Gana Kridam. Like that we can go. And the Tarpana and Anjana, it should be selected with potent Kriya Kalpana. That means Vasa Tarpana is mentioned by Acharya Vapada, that is Naktantya Vata Tevira Krishna Bodha Digevasa, or Egritipili Anchanam, which is mentioned in the Naktanti Chikilsa, and the Kanasaindavadi Anjana, which is mentioned in the Sannibada Timera Chikilsa. Sannibada Timera Chikilsa can be taken as a lead for treating the RP cases. So various type of vasti can also be administered. So this is an one yoga which is usually means we are practicing in our OPD, that is the Kana Saindhavadi Anchanam. The drug is only Ushiram, Pippili, and Saindhavam. So this is a very potent drug, and the Tarpana and Pudabaga is very important. And while during the this optic atrophy cases, actually that cases it is very difficult to respond. But if the patient is getting some benefit, then we can give the Vasanjana. Is a very potent medicines that we can adopt in this type of conditions. That is Varahavasa, Jivanti Churnam, Eshti Churnam, and Eshti Kashayam are the major ingredients, and we can prepare the Vasanjanam and it can be given to the patient for the long-term use in which there is a chronic degenerative condition is presented. This is the case of a wet ARMD, that is a 58-year-old woman. This type 2 diabetes, the left ocular pain associated with the headache, distorted and blurry vision. So this wet ARMD always it's followed with, or it always accompanied with the macular edema. So we have there is a pitta recta or kapha recta, that means the shofa haratvam and the recta prasadaka. Diagnostic case of macular edema with a CNVA for the left eye and CSR for the right eye. So I think now the slide is visible. Sorry for the disturbance. Okay, so here the patient presented with 3 doses of intravitreal injections and PRP also done. So this is the condition.
Okay. This was the condition of the patient. That means in 2020, the patient presented with right eye 6/36 and corrected vision 6/12, left eye counting fingers 2 meters. So actually the patient, I think, stayed in the hospital around 3 months. 3 months. That means actually the treatment of ARMD is very much complicated. That means we cannot administer the Brahmana therapy as a sudden. We have to wait for the response of the treatment. So at 13/5/21, the patient 6/36 vision was improved to 6/18, and the count fingers 2 meter. It is improved to 6/60. So the patient felt, or subjectively, she got very good improvement by adopting the treatment. This is the treatment that we have adopted. That is the Vicharana Snehavana with Tiktakam Kritam. That means we were started with after the internal medicines, then Abhyanga and Ushnabhusnanam with the Baladairam, then Virajana with Avipati, Takradhara, Nasya with the Shadbindu, Anjana with the Kaje Apanam, left eye, and Chandanadi right eye, then Shirodhara with the Madhyashthaja Tailamatic Shirabala, then Vasti with the Mathu Tailika Vasti that we have given. Okay, so these are the few cases that I would like to share with you. So now we are moving to the discussion part. So by this presentation, I would like to convey the basic idea regarding the management of the retinal diseases through Ayurveda. So we can divide these retinal diseases into 3 major categories. One is the edematous disorders, second is the bleeding disorders, and the third is the degenerative disorders. So in edematous disorders, we have to give more emphasis to the Kapha dosha and Rasadhatu, and in bleeding disorders we have to give the Kapha, Pitta and Rasarekta Dhatu, and degenerative the Vata dosha. So, but in the preventive aspect that we have already discussed, the preventive aspect we have to give more emphasis to the Kapha dosha. We should not allow the Kapha dosha to be vitiated, and it should be regularly removed from the netra by the help of Anjana and Pradimarshanasya. So these are the utility of the Panchakarma. We can adopt the Vamana if there is a Kevala Kapha or Ulkleshida Kapha is there, then we can adopt the Vamana, and it can be adopted in the early stages of the edema. And the Virajana, when there is Pitta Kapha predominant condition is there, and the bleeding conditions are there, then Urdhva Rektapitta Chikitsa can be adopted. And the Vasti in chronic degenerative diseases, Agnimadhyajanya Shofa. That means that we have already mentioned, that is the Vaishwandara Churna Vasti is very effective in treating the CSR, and a wide range of application in the retinal diseases. That is a Vasti that we have already discussed. That is a lot of Vasti mentioned in the Kajikasa can be adopted by modifying the Kalka, Taila and Kashaya for the sake of the maintenance of retinal health. And Rektamoksha, it can be considered as a universal application because it equally addresses the vitiation of Rasa and Rekta. So these are the Kriya Kalpa. That means all the Kriya Kalpa, including the Avaguntanam and the specifically the Shirolebam, Shirodhara and Gandusham is also having a very important role in the management of the retinal diseases. So actually in the management of the retinal disorders should be considered in box. That means we have to make a treatment protocol, because as we have discussed, the patient may be presenting with the edema and actually the condition may be a degenerative. So we have to wait up to the complete resolution of the edema, then only we can move with the specific treatment like Tarpana. So if the patient is ultimately indicated for the Tarpana, but we are not able to start it as a sudden, so we have to wait, make the protocol, and with that protocol we have to take the medicines from the Kaichikasa as well as our experience. We add the medicines to that black box and consider the treatment protocol under the black box design. So I would like to conclude the presentation by emphasizing these factors. That means the Kapha dosha plays a key factor in the retinal health. That means in a Swastha Vritta, the Kapha dosha is a factor which maintains the Vata and the Pitta in a normal stage. So any type of vitiation of Kapha dosha should be prevented for a healthy and a normal functioning of the retina. So Acharya mentioned that Anjanam Sanasyam Kridapanam Tadeva Netra Reksha. So we have to consider the Anjanam and Nasyam, and Acharya included Chakshus Tejomayam Tasi Vishesha Sleshmadopayam. So Pancharatre, Saptaratreva, Sravanarte, Rasajanam. Anjana should be done to avoid to limit the accumulation of the kapha dosha, and we have to give more emphasis to the Agni by making the purity of the Rasadhatu. And the Panchakarma including the Vamana and the various types of Talam, Takradhara, Churnavasti, Shirolebanam, Gantusham, Virejinam, and various types of Kriyakalpa can be adopted in the management of the retinal diseases according to the main and Anubandha dosha. So thank you. So sorry for the disturbance which happened during the presentation. So thank you for giving me a chance to present few ideas regarding the retinal health. Actually, it is a very small presentation. No, that means the details of the cases I am not able to discuss with this short time period. So thank you once again.
Thank you, sir. It was very elaborative approach and details regarding retinopathy in the Ayurveda. We have few questions in the chat box, so I'll take 2 or 3 and then we can conclude, sir. So there is a question from Dr. Ashwini Kumar.
Okay,
sir, is it audible? How to approach
yes.
pathological myopia as it is degenerative? We can directly head to Basti, or any other management is to be incorporated in this condition?
Okay, so this degenerative myopia should be treated with very care, because in our clinical experience, the patient presented with around I think -8 or -9. While during the tarpana, the patient immediately developed RD. So why it happens, we don't know, but immediately the patient went to a complications of retinal detachment. So the tarpana is a very potent treatment, but it is not easy to administer. So the eye are not maybe in a position to accommodate the tarpana. So the degenerative myopia, it is better to plan for a treatment protocol. So it is better to start with the Snehavana, that is Achavana should be given first. So after that, we have to move to the Snehana Nasya, that means Brahmana. And during at that time, we can give the Matravasti. And after that, it is better to plan for a Yogavasti. Yogavasti means Tiradhyapanavasti. That means the one thesis already done, the management of the pathological myopia, that is Tiradhyapanavasti, which contains the Kshira also. Like that, we have to consider the Vasti in the management. Then as a first treatment, we have to give the Snehana, Snigdha Talam and Snigdha Netra Piju. Netra Piju, we have to, don't go for the Tarpana directly. So just check whether that eye is able to accommodate the Sneha, then give the Sneha, Seka or the Snetra Piju. After that, go for the Tarpana. So it is better to do this Panchakarma, including the Vasti, and follow up the patient with the Chakshushi Rasayana regular.
Yes, sir. One more question from Dr. Achyuta. In case of macular edema, Lakshana found is Vakradarshana. How to treat this case, either by Kapha or Vatahara Chikitsa?
Definitely, that we have already discussed, that is a CSR. It is a one of the most commonly presenting cases, and I think Ayurveda doctors can get a lot of cases, because the modern science, they are approaching with lasers or intravitreal injections. Usually the patient is not at all convinced by that approach, because it is an immediately developed. So patient expecting that self-resolution itself. So while the patient is presenting, we have to take the history, that means a pathological aspect of the retina that we have detailed, that is means the role of Rasadhatu, the role of Vata, Pitta, like that we have to take. So the rasa vitiation should be there, otherwise the blood retinal barrier will not be adapted. there will not be any interruption of this blood retinal barrier without the vitiation of rasa dhatu. So we have to find out the cause and remove the cause first. Then we have to move to the lamkhana treatment only. That means we have to address if it is an recently, immediately presenting, acutely presenting, then we have to give the emphasis to the kapha dosha only. And if it is a recurrent one, then that concept is different. And if that CSR is associated with a diabetic retinopathy, the condition is different. So if it is an acutely presenting, only the CSR without no other disease, we can easily start with the Tikshna Nasya first. So Tikshna Nasya, then Takradhara, and we have to address the kapha dosha only. And after the complete resolution of this CSR, then we can go for the further preventive aspect by advising the proper pathya. So while we are doing the Tikshna Nasya, simultaneously we can go for a Rukshavasti, that is Rukshavasti with the Vaishwanara Churnam, Dhanyamalam and Amrutotram Kashayam we can give. So by this approach we can easily treat the CSR if it is acutely presenting. And if it is chronic one, then never think about the Vamana.
Sir, with respect to same CSR, Dr. Preeti asks, explain the procedure of Sadhyavamana in case of CSR.
Actually, the Sadhyavamana procedure, if the patient is having a very disturbed sleep, that means the Vata Kopaka Nidana is also found there, then we can go for a mild dose Sneha. That means usually we are giving say Gugulatik Kritam or Padoladi Kritam for 1 or 2 days. After that, the patient should be posted for the Sadhyavamana. Sadhyavamana means ST Kashayam only. So the ST Kashayam is given to take, and the Vamana should be precipitated by the Vamana Aushadha drugs. So this is a simple procedure. The patient, it's no need of any admission. So the patient can easily tolerate that procedure. But we have to analyze the patient in detail. About actually we know that Vamana is having a lot of indications and contraindications, that is systemic analysis also should be done. So if you are sure that the kapha dosha is a urdhva jatrugada sthana samsraya and then it should be eliminated from the nearby place, so we can adopt for the Vamana.
Okay, sir. There are a few more questions, but as you have mentioned, you have a meeting at 3:30. I'll take up one last question, and the remaining question can be answered in the group, I think, sir. Sir, what are the hetus you have observed? What are the hetus or causative factor you have observed in macular edema of your practice?
Actually, the main factor that I have seen is the associated system, that is the diabetes. So if I am telling that it is diabetes, then it is mainly in Ayurvedic terminology, it is the Rasadhatu Dushti or Kapha Vishesha. So in Rasadhatu Dushti, we means as we have already discussed, that means Guri Shidam, Adi Snigdam, Adi Matram Samashnatam. Rasavahani Dushyanti, Chintyanam Chadi Chintana. So mainly these are the main factors. So or other means if the patient is having a way of taking internal medications like that steroids or any other medicines which are causing any type of steroid supplements, then it is also found to be a cause. And some in the conditions like a CSR, it is mainly occurs due to the internal steroid. The internal steroid means it is adrenocorticotropic hormone, that is the adrenal cortex, that is flight hormone. That's over secretion occurs, means it occurs mainly if the patient is not getting proper sleep, or if it is always in the tension, always in a flight or fight stage, then there the internal steroid itself interrupt this retinal health, and this type of edema will be manifested. So actually a lot of causes are there. We cannot say as a single cause, but take the OCT, see the fundus, how the patient is presenting. Definitely the patient, they will present it with, there will be a central scotoma or there will be a metamorphopsia, then analyze, and this condition should be analyzed after each. If you are doing the Sadhyavamana, so immediately after the Sadhyavamana, go for the vision analysis and OCT and fundus. Then if it is not resolved, then again go for the Tikshna Vasti or means Ruksha Vasti, again analysis. So each and every point we have to analyze. Then only we can specifically get the idea that which treatment is highly effective to improve or to resolve the edema.
Thank you, sir. Thank you so much for your valuable presentation. It was really wonderful. We're blessed to have you on this day, sir. I would like to call upon Dr. Shashikala ma'am, Associate Professor, Department of Shalakya Tantra, SJG AMC Koppal, for vote of thanks.
Okay. Honorable dignitaries, distinguished guests, reputed principal sir, director sir, and dear participants, on behalf of SJGMC Koppal, its entire fraternity and the organizing committee, I feel immense pleasure to take this opportunity to propose the vote of thanks. First of all, I'd like to thank our eminent speaker, Dr. Sri Kumar sir, Associate Professor, Government Ayurveda Medical College, Tripunithara, Ernakulam, who spared the time from his busy schedule to grace this webinar with his extremely relevant address on understanding retinopathies in Ayurveda and application of treatment protocol. Sir has cleared doubts of many of us regarding understanding retinopathies. It was really a very good and logical presentation, as told by one of our participants, Dr. Rekha T. Thank you very much, sir, for sharing your valuable knowledge with all of us. Thank you, sir, once again. I would further extend a hearty thanks to Dr. Suvarna Gulecha ma'am, President TAS India, for being with us in her busy schedule. Thank you, ma'am. Thank you for being with us. I take this opportunity to specially express my deep gratitude and regards to our principal, Dr. B.S. Saudi sir, who is always encouraging us and providing opportunity to arrange such events. Thank you, sir. Thank you very much for supporting us in all our activities. I also extend my heartfelt thanks to Director Praveen Vaidya sir for his support and guidelines. Thank you, sir. I would especially also like to thank our HOD sir, Dr. Viraya Hiramat sir, who always will be supporting us for doing all kinds of activities. Thank you, sir, for keeping confidence in us and arranging such a wonderful webinar. Thank you, sir. I would also like to thank our colleagues, Dr. Gururaj sir, Dr. Raju, Dr. Ramya, for their unconditional work in making this webinar a grand success. Thank you, everyone. Now, I would like to extend my deep sense of appreciation to all the participants who choose to be live with us and attend this webinar with great enthusiasm and made it a great successful event. Thank you, all the participants. Thank you for this huge response. Actually, we have received almost 350 plus registrations. Thank you, everyone, for choosing to be with us. Last but not the least, I would also like to thank all the faculties of SJGMC and all PGs for their support in conducting this event in a success. Thank you, one and all.
Suvarna madam, it's on now.
Hello, Guru, Dr. Guru.
You're audible. Video has to be switched on from your side.
Okay, thank you.
Yes, sir.
Recording stopped.